Surgery. Surgery is a branch of medicine that treats many illnesses, injuries, organ malfunctions, or deformities by operating on the body. Traditionally, a surgeon cuts into the patient's body to remove or repair damaged or unwanted tissues, organs, or bones. Although modern medical instruments and technologies now allow for less invasive procedures, most surgeries require many people and techniques and a lot of medicine and equipment. During surgery, a surgeon is often assisted by another doctor, one or more nurses, and an anesthesiologist. Before surgery, the anesthesiologist administers a drug that reduces or eliminates pain for the patient. Historically, surgeons first tried to reduce surgical pain by having their patients drink alcohol or inhale opium. Then doctors used ether or chloroform in the 19th century to numb pain. Patients under these drugs, however, risk death by overdose. Today's anesthetics are much safer. There are two types, general anesthetics and local anesthetics. General anesthetics are used to put a patient to sleep. They are inhaled as gases, or they are injected through needles. Local anesthetics, on the other hand, numb only the area near the place of application or injection. These drugs block nerve impulses to the surgical area. Patients, although awake, will not feel any pain. Antiseptics are also required during surgery. Before doctors introduced methods to prevent the spread of germs, patients undergoing surgery were at high risk of infection. Many patients died from infections after otherwise successful surgeries. Joseph Lister of Britain first used antiseptics to kill bacteria in 1835. He would spray carbolic acid around the operating room during surgery to prevent infection. Today, surgeons use a complete sterile surgery method. All equipment and linens used in the operating room are cleaned and sterilized before surgery. Doing this prevents bacteria from entering the operating room. Many instruments aid the surgeon in making an accurate diagnosis. Doctors use an X-ray machine, for example, to see bones and internal organs without physically entering the patient's body. Other instruments are used to examine body cavities. The bronchoscope, for example, lets doctors look into patients' lungs and extract tissue samples. Surgeons use many instruments during an operation. These instruments include clamps to close off blood vessels, retractors to hold back skin folds, sponges to wipe excess blood, scissors and scalpels to make incisions, and needles to stitch incisions. Since the 1970s, surgeons have used lasers to make precise cuts. The high-energy light of a laser cuts tissues by burning fine lines in the skin or other organs. Such modern instruments have allowed surgeons to develop new surgical techniques. A popular modern alternative to traditional surgery is laparoscopic surgery, or keyhole surgery. It is used for operations in the abdomen. A surgeon performing keyhole surgery makes small incisions, usually 0.5 to 1.5 centimeters, rather than the large incisions used in traditional surgical procedures. Keyhole surgery requires the use of a laparoscope, a type of telescope connected to a video camera and a light source. The laparoscope is used to view the abdominal and pelvic cavities. Using a laparoscope, a surgeon can determine whether internal organs are diseased or damaged. During the surgery, the abdomen is inflated with carbon dioxide gas, and this allows the surgeon to better view and work in cavities and with organs inside the body. The laparoscope acts as the surgeon's eyes while he manually inserts thin cutting instruments through other small incisions. Keyhole surgery minimizes pain after surgery, speeds recovery times, and leaves minimal scarring. Despite its many benefits, not all doctors offer the procedure. Performing keyhole surgery requires highly advanced technical skills. Surgeons must have excellent hand-eye coordination and be able to work with restricted vision and fine instruments. Consequently, surgeons performing these operations are often specialists. Advances in technology have also allowed surgeons to help patients without being physically present. In remote surgery, a robot performs the operation while a surgeon oversees its movements from another office. Because remote surgery allows a single central hospital to operate machines at distant locations, further development of this type of surgery may help serve the medical needs of underdeveloped nations.